Hey everybody, today is Saturday and it's the first weekend where I'm actually feeling a little bit more like myself, not as tired, and I thought I'd come out to the lake near our house and talk to you guys. It's a beautiful day. It's probably like 85 degrees, but I'm sitting in the shade. The lake is not crowded because it's the middle of the afternoon. I think more people show up here at sunset, and it just kind of gives a lot of cool memories because we used to ride our bikes around this lake, walk around the lake, rollerblade, roller skate, all the things. So it's nice to see that it's still here, still nice, and still just very peaceful. So today I'm going to talk about health insurance and what's been going on with that since we left Bangkok. Okay, you guys know we're not big planners. That's how we live our lives. So when we decided that we were coming back to San Diego, we decided, and then within a month we were on a plane back here. And we were in Da Nang, Vietnam at the time. And so when we made the decision, we weren't quite stocked up on our medications the way we were stocked up when we were in Bangkok. And the reason for that is because in Da Nang, we didn't find pharmacies readily stocked with our basic medications that we needed. It wasn't like in Bangkok where you could walk up to any pharmacy and pretty much find anything you need. We went from a capital city to a small beach city, and we didn't have the forethought to think that, they're not going to really have all of our medications. And so after a couple of months there, we were starting to run low on our meds, and we didn't have a stock of meds when we came back to the United States. Let me just put it like that. We maybe had a month left of medications. So Mark went to the VA when he got back. No problem. It was seamless. Got back into the system, got his medications going, no problem. For me, I reached out to my PCP that I had had for many years, but I haven't seen her in 5 years. But I sent a message and said I was back in town. Would she send in some refills for me? And she was kind enough to send in 3 months of refills. So those were refills for 30 days, and each one had 2 refills. So I was like, okay, great. That buys me a little time. So fast forward to when I started working, and my employer does offer health insurance, but it does not offer that insurance on day one. There is a waiting period, and today I am still in that waiting period. Our global health insurance covered us everywhere in the world except the United States. Now, there was a provision for coverage of an emergency within the United States, but obviously that wasn't going to help me with a primary care appointment and getting my medications. So, after that 3 months supply of medications that I got from my PCP was running low. I was in the last month. My PCP obviously said, well, I'm not going to give you any more meds until you come see me. And so here I am, no insurance. So I'm thinking, okay, I'm just going to pay for the appointment, go see my PCP so I can get my medications up to date and get that year's worth of prescriptions called in. Now, the last time that I had labs drawn was in Bangkok, and it was in August of 2024. So when I came back to the US and I reached out to my PCP, I did send her that lab work, and I think that's why she was okay with sending in 3 months worth of meds. But to send in any further meds, she wanted to see me. She wanted me to get labs. So let me tell you. So I knew it was going to cost an arm and a leg to go see my PCP. And as a cash paying patient, the health system that my PCP is employed with, which is also my previous employer, gives a 45% discount on cash pay patients. And so I'm like, great, I'm going to get half off of this appointment. And so what I was charged was $269 to go in for the visit so that I could get my care reestablished and get my medications. Now, the total price for that was $509, I believe, and the 45% off brought it to $269 or $279, whatever it was. So because most healthcare is pretty much employer-based in the U.S., unless you sign up on one of the state exchanges, if you have an employer that doesn't provide health insurance, it seems like everything is a bit tighter now than it was 5 years ago. Now, I will tell you, here in San Diego, there are 4 major health systems. There's some other scattered systems, private practices, but really 4 major hospital systems here in San Diego. I've worked at 2 of those for most of my career, either one or the other. Well, coming back now, I am working at a system that is new to me. And so working at those other 2 systems, it seems like there was an insurance option where you could go to any health system in the city. There was always the one where you were going to the system you were employed with, but it always gave another PPO option where you could go anywhere. And so at either system, I could keep the same PCP, just depending upon that insurance, picking the one where we could pretty much go anywhere. Well, at my new employer, the only choices are 2 choices to be seen within that healthcare system. Now, and I understand that my previous employers have gone to similar systems where the employees are only given a choice to get their care within that system if they want to have insurance through that specific employer. So that seems like a big change since 2020. The options have been narrowed. I was talking to my PCP about this because I needed to get labs drawn. And what she said is she has several patients who don't have insurance within that system but want to continue to see her. And so they cash pay for their appointments and they go get their labs at an outside lab that's more cost effective because the lab charges there at that system have a high premium on them. So that was our plan. I was going to go to an outside lab, get the labs, and then figure out our next plan from there. Well, the outside labs sounded kind of sketchy in reading the reviews, to be honest. And also, they were only open from 8 to 12 and 1 to 4, no weekend hours. And I did not want to take a few hours off work just to go get labs. I mean, I'm working at a healthcare system. I like the convenience of being able to go get my labs, across the hall before work. But those days are over. So I ended up going to get the labs at my previous employer's healthcare system. And as of the filming of this video, I am still waiting for the bill to see how much these labs are going to cost me. Now, I still get that 45% discount, and I was able to get an estimate of what the costs would be, but I haven't been billed. So if I get that cost by the time this video goes up, I'll put it on the screen. The estimate was somewhere around $500 with the 50% discount. So the whole point of this is that I'm saying it's probably gonna cost me about $800 or $900 for a doctor's appointment and some labs here in the US, and this is without insurance. Now, as I mentioned earlier, I got labs in Bangkok in August, and it was a full set of labs, more labs than I got this past week here. And for all of those labs, I think we paid maybe 4,800 baht, which probably came to around $110, $120 for a ton of labs. And these are also labs that you could just walk in and request. You didn't need a doctor's order, you didn't need a doctor's prescription, because it seems like everywhere else outside of the United States, you can take some responsibility for your own health care. But that's like a whole nother discussion. The silver lining to all of this is that I did get my prescription sent in, and today on my way to the lake, I picked them up and I got 3 months worth of all of my basic meds, 4 medications. And the total cost came to $149 and some cents. So we'll say $150. And that was paying cash with any discounts I could find from GoodRx, things like that. And those discounts had already been applied by the pharmacy, so I didn't have to look for those coupons. So actually, that was pretty good, $150 for 4 medications for 3 months. I mean, we're talking $50 a month. So really that comes out to about $14, $15 per medication per month. And you know what? That's pretty reasonable, because I looked at one of our old bills while we were in Bangkok, and we would get our medications from one of the discount pharmacies recommended, not from the hospitals, because there's an upcharge there for those hospital pharmacies. And for 1 month of meds for both of us, we would probably average over 3,000 baht. And so in our budget, we thought around $100 a month for medications for the both of us. So again, we're at that $50 a month per person. And it was surprising to me when I picked up my meds today that they were pretty much the same price as they were in Bangkok. But if you add in the hoops I had to jump through, getting a doctor's appointment, getting a prescription, I mean, that in itself raises the price $800 or $900 cash pay. So I guess it really is more expensive. So really, figuring out health insurance and medical costs, I feel like that's one of the biggest challenges when you're living abroad, and especially for us coming back, you know, figuring out, okay, how are we going to cover ourselves? What if something happens? You know, all of the things, because like I said, our global policy only covered us in the event of an emergency, and it would only cover us here, you know, with very narrow parameters, and I'm sure the insurance company would find a way to fight it if we needed to use it. And we still have a few more days before I'm covered, so knock wood, let's just hope that I don't have a need for that. I will also say that my insurance coming up with my new employer will run about $300 a month for the both of us. But, I'm really not overly excited about getting care in a new system because all of my records, all of my imaging over the years, just all the relationships I have at the previous healthcare system. I don't want to have to recreate the wheel at this new system. So that is a little bit challenging. And I can probably talk a little more about why I feel that way after being back and just kind of seeing what's going on in healthcare and how that's different now than it was like maybe 5 years ago. It seems I can tell you there have been a lot of changes, and they're not all changes for the better. And so, it's definitely a conundrum. But over time we'll see how it all goes. And the final thing I'm going to say on this, it goes without saying how expensive everything is, especially with healthcare and with some of these insurance coverages that are being offered to people, especially seniors, some of those Medicare supplement plans, or just some of the plans out there that don't seem to really cover what people need. It seems like every time I've gone to the pharmacy since I've been back over the last few months, I have heard someone say, okay, I'm not getting that today at that price. I can just leave that there. I still have some at home. And that's just not something you want to hear at the pharmacy. And it's a huge, huge problem here. And quite frankly, I just don't see it getting any better. I only see it getting worse. I'm sure the people that I've heard say that, this time last year, they weren't saying that. And so again, that's a whole nother conversation for another video when we get into the costs of things, inflation, all of that. But I just wanted to talk a little bit about the healthcare and the health coverage. So if you live abroad and you're coming back to the United States, make sure you have a good supply of medications, because you're going to have to jump through some hoops to get your meds. You're not going to just roll up to the pharmacy like you're used to doing in country X, okay? So let me know what you think about all this. I'm always interested to read your comments and hear what you guys think. I always appreciate you watching, and I look forward to seeing you in the next video.